All right, good morning. Thank you guys for coming out. Welcome to our second annual Patient Education Day for our Georgetown Multiple Sclerosis Center. So I'm really excited that you guys came out. I know we have an early start. I'm going to kind of try to introduce our team briefly so we can get to our speakers. All right, first of all, this event really wouldn't have been possible without financial support. So if you've had a chance to come through, you know that we have a lot of different groups who have provided some funding to allow us to put on this program. So if you get a chance during the break or as you're circulating, at least say hello to these different people. They produce some of the treatments that we use to help our patients with MS, whether treating symptoms of MS or controlling the disease itself. Also outside, I do want to point out a couple of extra tables that are outside. For instance, our clinical research team is outside. I'm about to show you some pictures of who they are. But if you want a little bit more information about some of our clinical trials, they're actually straight outside and a little bit to the right. The National Multiple Sclerosis Society is also here providing support for us. So if you want to stop by their table, as you know, they sponsor a lot of different events, MS walks and things like that help raise money to help us do research for MS. Very important, the My MedStar patient portal person is available. So if you want to raise your hand in the back, if you go out and you go to the left, there's a table there. Whether you're enrolled in the patient portal or don't even know about it, please stop by because you can enroll and this allows us to communicate. You would have access to the medical record, be able to send us messages that are private. You know, email is actually not a great way to communicate with us because it's not really, it's hackable, so you want to be careful. Even if you're enrolled, the patient portal is evolving and changing, so you'd probably want to stop by to take a look at that. Ms. Kowal's in the back there again, waving her hand. Be Here Now Yoga is here. So we're going to have some presentations talking about wellness and exercise, but Be Here Now Yoga is actually outside, and I think she has a little raffle type thing, and also can talk a little bit about ways to be healthy, and then tied into that movement for MS. So Ms. Hart-Mendoza is going to actually speak to us later today. All right, well, this is a picture of the MS group. So if you did not know, the Georgetown MS Center is actually quite large, comprised of multiple healthcare providers. So if you look at our healthcare team, our physicians and nurses, there's really, I think, a very large number of us, nurse practitioners. I should congratulate, actually, Erica. You may remember last year, Erica couldn't talk because she was defending her doctorate degree, and so we can call her Dr. Erica now, Dr. Mitchell, so congratulations. But this is our healthcare team. Several of them are going to be speaking. I'm just going to say something kind of, I'm going to start out by alienating our audience, and then you guys will make it up by being good speakers. But we know that sometimes it's hard to get through to us, and it can be challenging when there's a crisis. I will tell you that for our patients who are having issues, we really are offering same-day or next-day spots to see. Our nurse practitioners who are on the basic front lines doing that. So from my point of view, they can do everything a physician can do. So I encourage you, if you're given that opportunity to come and see one of us next day, same day, any member of this team, I trust, all of them, I feel we're all honestly, if you put together the MS expertise in this group, it's really probably unmatched anywhere else on the East Coast, really, in my point of view. All right. In addition, and they're kind of hiding, so you can't really see them, but our administrative assistant team. So, if you look around the room, not everyone's seated down. There's actually a lot of people here. I know they're patients, but also family members and friends. But this is, we're anticipating probably over 300 people at this event, maybe 350. The MS Center takes care of probably 10 times this many MS patients, okay? So I don't know what our estimate is, probably over 3,000 patients. Our administrative assistants field a tremendous number of messages. I sometimes have patients who kind of tell me, I think that they're letting the voicemail fill up so they don't have to answer it, or I called and I never got a response back. We're trying to do better with that, but I have to tell you, our admin assistants are amazing. I've worked at many different institutions, and our admin assistants are incredibly hardworking. We are trying to get better at handling those messages, but please, if you get a chance to go out there at manning the front desk and signing you in, please just say hello, say thank you. They're actually a wonderful group of people. Okay, our clinical research team, again, outside at a desk out to the right. Another this is only 4 of them, but there are actually multiple members of our research team that you can see here. Lexi Ahmad actually is sort of our director of clinical trials, but she's leading a team that helps us. Basically, they're doing the clinical trials that allow us to discover the treatments that we're using to help our MS patients. So there are probably people in this room who have been participating in clinical trials, and I really salute you and I thank you for helping us learn more about MS treatment. If any of you are interested in maybe participating as well, you can find out more information. The clinical trials team here at Georgetown across MS, movement disorders, headache, stroke, they're running probably over 30 clinical trials as we speak. There are at least 5 clinical trials specifically for MS that are enrolling right now. So again, if you get a chance, please stop by. All right, so this is our website. Just so you know, I'm going to make a couple of general announcements. All of the content today is being videoed and is going to be available on the website. So if you want to review another talk, you can always log in. We have other materials there, bios of all of the faculty and healthcare providers and staff as well. So please check it out. Okay, Bethany Schreiber wanted me to make a couple of announcements. First of all, make sure if you haven't already to check in up front, and especially to get your parking validation, all right? So we're fortunate that this facility is supporting parking, but I also have to remind you, it's not like all-day parking, okay? This event is going to end. Bethany was like, I parked, I go down to Georgetown, have coffee or something like that. So after this event, the garage is going to shut down, but make sure you get your voucher for the free parking for this event. Secondly, you'll notice there are index cards on the tables. We have a lot of speakers, and I'm sure you're going to have questions. Please jot them down, and we're going to be collecting them during the break and throughout the day, and we have a Q&A session at the end where we're going to address them. It's probably not possible for us to do Q&A after each presentation, with one exception. The last thing I'll kind of mention will be at the end is there is also an opportunity to provide feedback. So you may notice if you guys were here last year, we did collect feedback, for instance, on what topics would you like to hear next year, and we really take that to heart. So again, I'll remind you again before the program is over, but we really do take your feedback seriously and try to incorporate that into our program. All right. So without really further ado, our first speaker doesn't really need introduction. Dr. Tornatore has directed the MS Center for a long time. 2 years ago, he was actually promoted to chair of the department. So like all great leaders, he's been sort of sharing the responsibilities with the rest of the MS Center. But he continues to retain this very important role as executive director of the MS Patient-Centered Specialty Practice Project. And he's going to give us an introduction to that today. So Dr. Tornatore.